You're watching continuing coverage of World Healthcare Congress 2012 from Washington, D.C., and we're very pleased to welcome Michael Cotton to the studio chair today. And we're really looking forward to getting to know you as the new CEO of Alere, a leading provider of health management solutions. Welcome.
Thank you, Mabel. I'm glad to be here.
Now, in terms of your new leadership at Alere, are there things that you have a vision for this company going forward?
Absolutely. I think our solutions that we're developing are very much focused on preventive care services and really providing care to the most complex patients that are out there. In addition, with healthcare reform, we're also looking at ways to collaborate with physicians and physician organizations as the advent of ACOs and primary patient-centered medical homes come into fruition. Our goal is to be collaborative with those entities, also work on those spectrums of preventive care and complex case management.
Well, certainly people are more willing to come to the table and collaborate, as you say. Do you have the support systems there to really come up with great results?
We do. We've actually, our business is founded on being care management. And so we've taken those tools and expanded them to have solutions for physicians, for hospital systems and other organizations who are seeking to partner with health plans or do ACOs on their own and have the capability to do reporting, wellness solutions, EMRs, PHRs, the full suite of services necessary to be successful under the CMS guidelines.
Can you give me some specific examples of what the tools are you're referring to, some of the solutions?
Absolutely. For example, one of the best ways to do a good job of managing patients is understanding where gaps in care are. So our techniques and our tools allow us to look at claims information, claims data, and symptom data, put that together in a clinical decision-making tool and algorithm, and identify where services may be necessary for a patient. For example, if a patient is due to have an A1C test, we can identify that early on based upon the data, communicate that to the patient as well as to the provider to make sure they get that needed test.
Okay, so a patient who might be watching this is saying, wait, doesn't my doctor do all of that?
Well, they do, but how often does everyone always go to the doctor when they're supposed to go? So having that assistance, that extra tool, that extra support in identifying when those services are necessary, we think will get better compliance and reach and allow us to have better outcomes.
Are you finding that the other players in the healthcare sector are receptive to these kinds of support solutions?
We do. We're finding more and more as we get closer and closer to reform, collaboration will be the key. So organizations that perhaps were competitive are now finding ways to collaborate and be partners. So as we talk to hospital organizations, employers, and even other health management companies, we're finding ways where we can work together to bring our best solutions to the table to meet the needs of the customer.
Does some decision making still to come add some level of complexity here? The Supreme Court is going to be ruling in June whether parts of this law are legal. So how does that affect your day-to-day or even month-to-month work at Alere?
Well, it will certainly impact the number of people who may be covered under healthcare reform. The individual mandate that you're referring to, as it's written in the law now, says that everyone has to have healthcare coverage, so to speak, which would actually bring about 35 million more people into the health insuring world. Those people have chronic conditions as well as are in need of preventive care services. Our ability to provide those services will be profound and I think help us really have an impact on healthcare. If that law changes for some matter, those people will still need those services and still need healthcare. So we think even with the change, if there's a change in the law, there will still be a need for the services and the ability that we have to manage patients.
Any new innovative strategies that you're working on right now that you can give us a hint about? Things coming down the pike?
Well, certainly mobility is going to be one of the key aspects, engaging with people on mobile phones, mHealth as it's been referred to. And we've got a couple of applications that we'll be rolling out in the next 60 to 90 days that will allow us to have a great impact in managing diabetes, heart failure, and perhaps also as we look at COPD. So those are new programs that will allow us to engage and identify people more readily and have them engage with us to better manage their condition.
All right, Michael Cotton, thank you very much.
Thank you.
We've been speaking with Michael Cotton, new CEO at Alere. I'm Mabel Jung. Thanks for watching.